I'm not blaming the practitioners. I think it's part of the education. Is if a person comes in that could potentially have a root canal, they immediately go to implant. Right? We'll just take that out and do an implant. And so endodontics has kind of gone to the back seat. You know, all of these things were made worse by COVID because what happened here, the education, instead of taking the year over, you know, dentistry is very technical. It's very hands-on, repetition. We need reps. And they should have taken that year over, and they didn't.
Welcome to the Oral Systemic Connections Podcast. I'm your host, Dr. Tom Larkin, here to explore how your oral health connects to your overall well-being. From heart disease to diabetes, your mouth is the gateway to your body. Let's dive in.
Welcome to Oral Systemic Connections. I'm your host, Dr. Tom Larkin, where I introduce you to amazing people. The topic of today's discussion is I choose teeth. Did you know that there are dentists that choose dental implants over teeth? Well, we are going to get into this very controversial subject with a special guest from Linhlan, Australia, Dr. Linhlan Nguyen. Good morning. No, it's good evening to you. You know, I don't get up at 5 o'clock in the morning for just anybody. Okay, this has to be pretty special. So you're 9 o'clock in the evening, and I'm 6 o'clock in the morning right now. So welcome to my podcast. I'm going to kind of surprise you and kind of get into some controversial stuff. You're an amazing dentist. You really have a heart for people. And what I'm trying to do is highlight individuals who I think are extremely unique. My podcast last week, I said, I find people anywhere. Well, you're by far the furthest away. You know, I have a little following in Australia. And so I was looking on Google Maps. So how far from Sydney are you?
3 hours drive south of Sydney.
Oh, okay. Okay, it looked a little bit closer, but it looked like a beautiful area. There were like nature areas and like a mountain and different. Is it a beautiful area?
Yeah, it is on the mountain. We're about 600 meters above the sea water level, so to speak. So we're high up, and the capital city, and between Sydney and Melbourne used to not able to decide who's going to be the capital city, so they chose something somewhat in between, and that's where Canberra was born. So Linhlan is a suburb in the capital city.
Okay, all right. Well, it looks gorgeous. It looks beautiful, and I am coming sometime. You know, maybe this year. I need to come over there and see all these people doing amazing things. So let's go back and talk a little bit about your origin story. So you're originally from Vietnam and then you immigrated to Australia. How old were you? At what age?
I was almost 17 at the time when I came to Australia. Yes. So I almost finished. I was a complete year 11 in Vietnam and then left and came here, start learning English and back to year 11 again.
Wow. Yeah. Well, you have a beautiful accent, Australian accent.
Okay. I didn't realize.
So tell me this, because I always ask people, you know, that's that high schoolish age. What were some of the influences for you to get into healthcare? Obviously, you know, healthcare is a particular path. Someone inspired you to say, you know, this is something that makes sense to me that I would like to do. Was there someone who influenced you?
Yeah. I came to Australia almost at the age we finished high school, and at the time was new in the country. And as you know, kids growing up in Asia, usually we follow our parents' footsteps. You know, my dad was a lawyer back in the Republic of Vietnam time, and mom was a pharmacist. So chemistry was my worst subject in high school. So I often till these days, I was saying to friends that I still have nightmares when I'm stressed, but I'm failing chemistry exam. So obviously pharmacy is out and English is too new for me, so I can't do law. So I wasn't sure what I was doing. And then my dentist, he's a new graduate at the time, was that doing dentistry is fun. Give yourself a year. If you didn't like it, you can always find something else. And at that time when I came to Australia, computer engineering was in fashion. because everyone seemed to be doing that. And next thing would be, so lots of pathway, but I think it's my dentist at the time, and he's still practicing. He's a periodontist now in
Wow.
Sydney. And so that I'll give it a go and never look back beside that.
Wow. Well, I was looking at your resume, just an amazing amount of training and dedication. We have a little commonality. So this is probably 8 years ago. I spoke at the Fotona Symposium, and my topic was the oral systemic laser. And of course, no one back then knew what I was talking about. And what I had identified, and you've heard me talk about the Bale-Donine method of cardiovascular prevention. And what I liked so much about the Fotona laser was it addressed, the 3 areas of concern if you were practicing that area of prevention. Night lays for sleep issues and snoring, the twin lays for the perio. And the thing that I really was fascinated with was the photoacoustic streaming with the endo, with the laser root canals, because endodontics is it's probably more controversial now than it was 8 years ago. And you just see message boards and a lot of anti-endo, but people don't even know why, right? And so when I saw the procedure with the laser and the complete decontamination, because the issue that goes back to Weston Price in 1930s was that you're leaving tissue behind inside of a tooth, right? So when I saw this incredible disinfection using a laser, I said, there's your answer, right? So anyway, I've been a fan of Fotona. And so you've got a couple of different master's degree in laser. So the one in at Catholic University in Rome, is that with did you do that with Philip Hand and Jason Pang? Were they involved?
That's correct. Yes, I was in the first batch of postgrad they offered. Yeah.
Okay. Oh, that's cool. That's very cool. So 2020. Now, the other thing that really caught my interest, because you're so incredibly well-rounded, is the orthodontics and dental facial orthopedics. When any one of these fields, when you step into it, you realize how massively big they are, right? What the incredible need is. What I'm finding here in the States is that people that get involved in sleep, it almost becomes an entire practice in itself. I mean, it's so complex. And it's so necessary. Just to show you, there was a tragic story on the news last night. A 5-year-old child with HD and sleep apnea was put into a hyperbaric chamber, and the chamber exploded, and the kid was killed. And I was like, and so the people who owned the place, they were charged with manslaughter and the whole thing. But it's just this whole tragedy of children with these issues, and they're airway issues, right? ADHD can be to a certain extent. And if you look at this individual, it's so obvious, right? But it's just getting the dots connected in this whole oral systemic world that people are not making it to the right dentists. So you have a lot on your plate. You're just constantly learning. I had the privilege of meeting you a few years ago. So I'm going to show you a slide here. And this is the first time that you made it into one of my presentations. Okay.
Oh.
So this is and I want to show you the contrast, because this has happened to me twice. Okay. These are 2 social media posts the same day. So when I talk about this in my presentation, you make this presentation about, that you had bought your second airflow, and I'll read this in just a second. And then I saw a post the same day, difficult conversations between the dentist and the hygienist, and the whole context of this, it was very negative, and it was about hygienists leaving the work environment, toxic work environments. They're being labeled as divas, disrespected, disregarded, and discouraged. And so when I look at your post in the same day, at the same time, you said that after joining the Larkin protocol approach to better health, your patients are more cooperative in looking after their oral health, seeing value in services, because that's one of my mottos, is creation of value in hygiene. Our team has fun every day. Well, it didn't sound like that other office was having fun. They co-interpret every microbial sample, and that involves patient education, the promotion of good health, right? So I put
Yeah.
this slide up when I'm presenting, and I said, which one is it? Okay, which one is this? Which style of practice do you desire, right? Do you want to get into this whole, because the root cause of all that negativity is lack of leadership and lack of direction. And I don't have any, I've never met you in person, but I know you're a strong leader, right? And the people follow you. Okay. So that was the first time that you came on my radar, and I said, well, that's pretty cool. And so you're in my presentation. Now, this is the second time. All right. And that's why we're here talking about I Choose Teeth. All right. So this is a post that you made. Beautiful photography. You know, you've also taken the time to learn how to document these cases. I mean, this is outstanding photography. So I see this, and that very same morning, there's a post about a dentist who last week lost his license, all right, for a variety of violations. And one of them was using a non-sterile tool in the mouth. But this was really, really the take-home point for me. The board alleged that there was no clinical evidence that removing all of the patient's teeth was necessary. Specifically, the radiographs show the majority of the teeth extracted were restorable, and they contained long, healthy roots and only mild bone loss, according to the report. Now, this case here on the lower, I'm just telling you, that's an all-on-X case in a lot of practices, okay? And all-on-X for my audience is full extractions and implants, okay? And this is happening, and it's happening for a variety of reasons. It's happening for economic reasons, but I think it's happening because of ignorance. I think the root cause of this is ignorance. I don't necessarily mean that these are bad people doing this. You know, our education system has let us down in so many ways. So the reason why I highlight this, 2-decade-long journey that you have made to become an excellent clinician is you didn't learn to do this overnight, okay? And you didn't learn this in school, right? This was a methodical approach where, number one, you had to create awareness with this patient, because this is pretty bad, okay? This before slide. And then you had to have the patient, what we call, they had to buy in. They had to have confidence in you, believe in you, and that's a lot of work right there. So I just need, what I'm trying to do is I'm trying to get inside your head. Why did this make sense to you? And I think it's obvious because of, over a period of time, you have to practice with a pretty high level of confidence.
What if your role as a dental professional could go far beyond teeth? What if you weren't just treating mouths, but saving lives? Preventive dental care is evolving rapidly. The oral microbiome, salivary diagnostics, laser, biofilm therapy, they aren't just tools, they are the future of healthcare. They're turning hygienists and dentists into leaders in disease prevention and whole body wellness. The question is, will you lead this change or be left behind? This is your moment. My name is Dr. Tom Larkin, and as a founder of Proactive Oral Wellness, my mission is simple: to equip you with the tools and processes to transform your practice and your patients' lives. That's why I'm inviting you to join me and some of the nation's leading experts in Lexington, Kentucky on April 26th for the Future of Dental Hygiene 5, The Blueprint. We will unpack the framework of the wellness-centered practice, new patient onboarding from a variety of really unique practitioners, specific preventive protocols, medical dental collaborative communication platforms, AI and prevention, and the revolutionary products that are bringing so much hope to this movement. And my podcast listeners get an exclusive offer by entering promo code POW. That stands for Proactive Oral Wellness. Every event that I've held so far has sold out over a month in advance. So reserve your spot early at oralsystemicmastery.com. Hope to see you there.
Yeah, I think I would say to many young graduates whoever that you started first, your first one or two, employer or where the practice that you're with will probably will lead you to the path of practice that you will carry on later in life. So, and I was lucky enough after I when I graduated, I worked in country town, and that was really high flow restorative. But that's about all dental restorative, but that got me high speed, doing things organized, because a lot of basic dentistry, that we have to get through in a day. But then when I got back to Sydney, Western Sydney at the time, two of my employer, my boss at the time, they both at the time, Dr. Mock, William Mock and Simon Skiffington, and they're still practicing today, almost retired, but they're still practicing. I've seen how they, at the time, they practice what we call chirodontics. And so they're already into body postures, and I could see in front of my eyes where patients who have class 2, div 2, slouching posture. And after they have all of this work done, orthopedic work done, photo by, braces, or restored their functional vertical dimension with consideration of the TMJ, and see how well they turn out to be and how beautiful they turn out to be naturally.
Right.
That built in me the fact that I would just, wow, we can actually do this. And it reminded me every day, because one of the practices I worked was above a medical center. So we got a lot of sick people being referred by medical practitioner. And so I was saying that, so that built into me, that the thought that we can make a difference. And the second person that sort of made me start to think again, because they practice following Dr. Skip Trush, who recently passed away. And Skip is one of those promote, again, airway, TMD. So I sat on his orthopedic program, straight through. And then I sort of got young children and moved away and got to practice my own, very busy for the first 5 days, basically general dentistry. But that in the back of my mind until I can start to step back and look like, hang on, this can't be just to get through the day. This is not what I want to do for the rest of my life. Right. And that's when we start to look at different courses and, like when we do, and along, of course, when we do courses that progressive, we meet progressive dentists or colleagues, and they just lead you on. And basically, in any course or any meeting, that sometimes people just present things and say, oh, yes, I see this every day. I'd like to know more. That's something just interesting. From there on, we just keep going. We keep mingling and, and then basically we just need our colleagues to open mind and see what's up there. And so the day is busy, but it's fun. It's very satisfactory to actually, help someone else.
What you saw with that, orthopedic, craniofacial orthopedics. So, my history, so I started using the microscope in '89, but before then, there were two issues that I saw as a young man. And one of them was the orthodontics. And I got really involved in the mid '80s with the International College of Craniomandibular Orthopedics. And I was fortunate enough to be trained by, some legendary people, Barney Jenkelson. So, he was in his 80s when I was in my 20s. And we were looking at these faces, because it was very popular back then to remove the bicuspids, right? Yeah. And what happened was, instead of looking at the face, we were looking at the models as if they were on a bench top, right? How do we make these teeth straight, irrespective of the face, right? And it's like any of this stuff in the oral systemic space. Once you see this, you can't unsee it, right? And it was like, oh, this is awful. Some of the results of contracting these arches. But what was not known then, which is known today, is the effect on the airway, right? I mean, that was the big thing, because when you treat the teeth in singularity as an island, and the teeth look straight, but the patient can't breathe properly, you haven't done them a favor, right? So when you see these beautifully developed arches, beautifully developed, beautiful smiles, and everything, it's transformative. It sounds like you had some really great mentors. So that was, that's one aspect of the oral systemic. But I think today it's still an extremely, extremely underserved market. There are just a lot of people that that are not cared for properly.
It's just like most dentists. Sorry. I just like
No.
most dentists, we don't like doing perio, treatment because hand scaling, strenuous, it takes forever. So we're all steering away and look at our patient and saw inflammation and quickly dust it off and hope someone else will fix the problem, hope the patient brush better. And then until we start to sit into implant lectures and start to, I think the first time I heard was in New York at one of the ICOI meeting, and they mentioned apparently there's a high incidence of implant failure that happen in mature men. And, we will have to start to screen for vitamin D deficiency and that kind of thing. And that's right. I got quite a few patients now, older male, that I have struggled. Implant went well, everything gone good, and suddenly it's just gone downhill. And then that's when I think Paul Boltus that passed away had insisted I got to go listen to Sue and be involved with Sue Ruslan. And I kind of, so many things at the time, like masters and things going on. Until what I start to listen, I'm thinking, hang on, this explains why my male patient having problem. Their biofilm is a problem. And often, yes, male tend not to look after their dental health well, general well. And so therefore, there's a problem. That kind of look, okay, so I want to solve the problem.